Om Dhanvantari Namaha.
Shri Gurubhyo Namaha.
Namaste and a very warm welcome to this wonderful session. I am Dr. Neela and I will be your host for today. Beautifully organized by Team Ayuryana, with humility and respect, I bow down to all the revered gurus and esteemed guests present here today. It is my honor to welcome our distinguished guests, the organizers, and our enthusiastic audience to today's session. I would like to introduce Ayuryana. Ayuryana is a holistic platform that brings together diverse activities, fostering a unique blend of learning, exploration, and community engagement. Its initiatives include online and offline classes and workshops, informative articles and health tips, health focused camps and events, recreational activities and excursions for the students, individuals with physical challenges, seniors, and the general public, sustainable tourism programs such as ecotourism and agritourism. Ayuryana proudly blend tradition with innovation, events and activities incorporating traditional practice, local cuisine, and rural games. It's inspired by the timeless principles of Ayurveda, thread moral, cultural, and traditional values into every experience, creating a rich tapestry and heritage and wellness. There is an executive announcement from Ayurana. I request Dr. Radha ma'am to share the same.
Om Dhanvantari Namaha. Namaste all. I heartily welcome you all to our webinar series on Ayurveda practice. I am Dr. Radha Chetana, co-founder of Ayuryana. We are going to conduct 2 days residential workshop on Ayurveda practice at Sara Center, Batte Mallappa on 24th and 25th May 2025. This is the second workshop we are hosting. Workshop includes 8 sessions where our eminent speakers going to share their decades of experience, guide us to apply Samhita into practice, discussion on doshas, lifestyle disorders, treatment with and without Panchakarma, Ayurveda cardiology, emergency care in Ayurveda, and even the herbal visit to study the drugs, and many more sessions and activities are awaiting for you. So all the UGs, PGs, and even the practitioners can join the sessions. So the brochures, details, and the Google Forms are shared in the group. If it are not in the group, drop a message, workshop in the chat box. So we take limited seats, register soon, and join us for the enlightening journey. Thank you.
Thank you, ma'am. Now I request Dr. Meghana to introduce about webinar and speaker. Welcome you.
Thank you, Dr. Neela. Let's see what our free Ayurveda webinar series is. Webinar series on Ayurveda practice is a free webinar series conducted on every weekend for an hour. The motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through innovative approaches in Ayurveda entrepreneurship. Our today's speaker, Dr. Chandu Anand Metri, sir. It's my privilege and honor to introduce the esteemed CV, Dr. Chandu Anand Metri, sir. I'm thrilled to share sir's impressive credentials and achievements, which serve as a testament to his dedication and expertise in the field of Ayurveda. Sir has completed his UG from KLE's BMK Ayurveda Mahavidyalaya, Belagavi. Sir has completed his PG from SDM College of Ayurveda, Udupi, in the Department of Panchakarma. Sir has completed PhD from Government Ayurveda College, Bengaluru. Sir served total 10 years of clinical experience in different Ayurveda medical college and hospital after the completion of his MD in the Department of Panchakarma. Working as a Panchakarma consultant at Suraksha Ayurveda Chikitsalaya, Ghataprabha since 2015. Sir has treated more than 40 avian cases and also he has a specialty in spinal disorders. Not only this, Sir also published many articles in indexed and peer-reviewed journals, such as a role of Manjishra Diksharabasti in the management of avascular necrosis of femoral head, a case report on the management of post-surgical complication of laminectomy in Ayurveda, and management of Bagandhara, that is fistula and eno, with Kshara Sutra and Panchavalkala Kashaya sits bath. A conceptual study of Grudrasi, role of Agni Karma in the management of frozen shoulder, Basti as Ardha Chikitsa, a critical review, understanding of Abhyanga in the relation of skin anatomy, a conceptual review, an integrated approach in management of sciatica and its case series. Not only this, Sir also did many paper presentation, likewise diabetic nephropathy, Ayurvedic perspective in Meha national level seminar, hepatocellular carcinoma, Ayurveda perspective in Ekrit, Vikara national level seminar. Paper presentation at Sushruta Avapodini 2022 and a paper presentation on avian hip joint at Vishwa Vyakyanu Mala, paper presentation at Punarvasu 2024 on cosmetology, and list will be going on like this. Now I request our audience to drop your doubts on chat box, and Sir will be clarifying at the end. I once again welcome you, Sir, and the mic is yours.
Yes, ma'am. Am I audible?
Yes, sir.
Guru Brahma, Guru Vishnu, Guru Devo, Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Nama. With the blessings of all my gurus and with the respectful prompts, we shall begin with the today's session. First, I congratulate the Ayurveda team for conducting such a informative events and medical camps for the Ayurveda practitioners as well as the students to upcome the Ayurveda practice. And I also thank Dr. Radha Chetan, Madam, and the team Ayurana for inviting me as a guest speaker for this today's session. So today I have taken the topic that is management of avascular necrosis and Ayurvedic perspective. So there are many topics were there to select, but why we have selected this avascular necrosis? Because the present days after the COVID, it has increased more than 10 times this case. That's why this is a very burden disease in the present era. That's why we have taken this one. So, what is avian? Avian is a death of the bone tissue due to the loss of blood supply, and also it is called as the chondritis or Candler's disease, commonly affected in the femoral head, and it is a progressive pain, and it has a when it becomes chronic, there may be a chance of the joint collapse and disability to walk also. So there are many modern etiology concepts are there, the trauma and the continued use of steroids and alcohol abuse and sickle cell disease. These are the main common etiological factors for the causing of the avascular necrosis. So in contemporary science, that is modern science, the treatment goes like conservative treatment and minimal invasive procedures and surgical management. Conservative treatment like that, they may give the painkillers, anti-inflammatory drugs, and minimal invasive procedure like core decompression and bone marrow aspirate concentrate, and the surgical management like the total hip replacement. But this is not a final one, and even in case of the surgical hip replacement also, there are some of the complications may arise, and in future also there may be a chance of the again once more the replacement. So there are many of the challenges are there to treating the avascular necrosis of the femoral head. So current incidence and prevalence in India, annually there are approximately 16,000 new cases are presently appearing in India and diagnosed in each year, with many patients of eventually require the total hip replacement. So age and gender distribution, about the around 32 years of the age, the avian may occur in the men's, and predominantly affecting the men. The ratio between the men and women, that is 3 is to 1. So post COVID-19 trends, there has been a notable increase in the avian cases following the COVID-19 pandemic, particularly likely to corticosteroid uses during the treatment. A study from the Central Karnataka reported that significant rise in the total hip arthroplasty procedure due to the osteonecrosis in the post-COVID era. So, avian decoded with the clinical needs in the classical the traditional practice with the Ayurveda, that is in modern concept, we call it as already discussed, like avian is a necrosis, that is the avascular necrosis is a bone death due to the interrupted blood supply, often silent diagnosed it is lately. But in Ayurvedic analog, it may be correlated with Asti Majjagata Vata when Vata enters into the Asti and it does the more Rukshata, that is dryness in the bone marrow, and it destroys the bony tissue as well as bone marrow tissue, and it weakens the structure of the bone marrow. And just like a wind dries a root beneath the tree, like that, it may be the pathogenesis goes according to the Ayurveda, and it is correlated with the Asti Majjagata Vata. So, am I audible, madam?
Yes, sir.
Yes, sir.
Yes, sir. You are audible.
Yes. So, goal of Ayurvedic management in avian is the avascular necrosis is explore how Ayurveda, with its holistic and traditional approach, can contribute to the managing and potentially improving the conditions like symptoms relief and pain management, and improve the bone and joint health, and circulatory and cellular support, reducing the dependency in invasive treatments, and delaying or preventing the joint collapse, specifying the aggravated vata, and rejuvenate the asti and majja dhatu, that is regeneration, and understanding the pathogenesis in terms of Ayurvedic terms, and holistic and long-term management. These are all the objectives, or these are the goals of the Ayurvedic management, where we are treating the avian cases. We need to achieve these things. So understanding the avian with Ayurvedic terms, of course there is a dosha involvement, vata dosha, yes, because without the vata there will not be any avarna, there will not be other pathology, and there is what we know, that is pittam pango kapam pango pango maladhatva, like that. The vata is the main cause for the almost all the disorders in the body, as well as the vata is a this majja and bone is the main seat of the vata dosha. That's why the dosha may be predominantly the vata, and dhatu involves, yes, of course, asti dhatu and majja dhatu. Even the rakta dhatu involvement also seen in the dhatus. And sotas is, yes, asti vasotas, majja vasotas, and also the rakta vasotas may be seen. And upadhatu kshayata, deflation of the upadhatu may be seen. And with all these things, there will be a shosha, that is degeneration of the bone, and there will be a pain, and there will be a sankocha, that is stiffness, and there will be a sometimes shota. So these are all the understanding in terms of the Ayurveda. This avian may be taken. So these are the clinical presentations where the symptoms may Bedu Astiparvanam, Sandishulaha, Satataruk, Karmaksheta, and patient unable to walk. And this, the breaking type of the pain and joint pain and continuous nature of the pain, loss of the strength is seen in the avascular necrosis of the femoral head. That may be a correlative with the Majjagata Vata symptoms directly with the clinical presentations. So physical findings, yes, tenderness will be there. It may be bilateral, and most of the times it is bilateral in the men's, and minimum less times it will be a unilateral one. So which joint is affected, there will be a tenderness, and moment it will be painful moments, and limping will be there while walking, and limb shortening may be present or may not be. In chronic condition, the limb shortening may be observed, and in acute condition there will not be a limb shortening, and tone hypotonic. So coming to the understanding the pathogenesis of avian and Ayurvedic perspective. So we have the three doshas, that is Vata, Pitta, and Kapha. The normal function of the Vata is basic energy behind the cell division, and normal function of the Pitta is energy behind the cellular metabolism, very important. And the basic function of the kapha is energy behind the cell growth. Very important functions, that is vata, pitta, kapha has in our body. And abnormal function of the vata may decrease the rate of cell division, and abnormal function of the pitta may improper the metabolism in our body, and abnormal function of the kapha may cause the improper cell growth in the sharira, that is in the particular part of the bone. So with this all the abnormal function, vata abnormality causes there is no nutritional supply to the that particular part, and pitta abnormality causes improper metabolism. Then it stops the cell growth, cell stem growth, and the improper cell growth due to the kapha vitiation, there will be obstruction of the micro and macro channels of that particular part of the bone. Then it causes there is no blood supply to the particular part of the bone. So if the blood supply is not there, then of course there will be a death of the that tissue or cells will occur, that causes the avascular necrosis. So this is a healthy hip joint and avascular necrosis hip joint. So you may see that with the avascular necrosis, there will be a death of the bony tissue, and it will cause necrosis, and there will be a depression, or the some part of the joints will get destroyed, necrose. So coming to the management of the avascular necrosis, the basic principles of vata chikitsa. So vata we need to take care for the as a dominant dosha, so we need to treat according to the vata dosha. So basic principle of vata vyadi chikitsa is vata shopakramah sneha svedo samshodhanam mruduhu swadam lavanam ushnani bochani abhengamardhanam vishtanam trasanam seko madhyam vishtakai rodikam signoshnah bastayo bastiniyamo sukashile. So we have to take here snehana svedana samshodhanah, snehana svedana samshodhana mruduhu abhyangah mardhanah snigdha ushna bastayo bastiniya sukashile. So these are very important one to mitigate the vata dosha and to control the vata dosha and to improve the normal function of the vata dosha. If once the vata dosha normal function get improved, then automatically the pitta and kapha will come in control with the normal function. So treatment approach in the avascular necrosis goes like this. First, Panchkarma treatment and Shamana Chikitsa, Rasayana Chikitsa, physiotherapy, and yoga asanas and lifestyle modification. These are the steps we need to take depending on the disease. If the patient is required for the Panchakarma Chikitsa, then of course we need to go with the Panchakarma Chikitsa. If Shamana Chikitsa is needed, then we need to go with the Shamana Chikitsa. So, but in most of the times, the Panchakarma, that is the Shodhana therapy, is needed for the avascular necrosis. So coming to the Shodhana Chikitsa, there are, yes, the Snehana Karma and Shodhana Karma. Snehana Karma in terms of Abhyanga and Snehapana we are taking. In case of the Basti Karma, we are taking Abhyanga followed by the Bashpasveda. And in case of Virechana, if we are going, we need to go with the Snehapana, Abhyanga, then Bashpasveda. And sometimes in Parisheka Sveda also we are taking as a Svedana Karma. And Basti Karma, most of the times, in particularly I am taking with the looking into the Amshamsha Kalpana of the disease and dosha and dusha. I am taking the Basti Karma as a main treatment, that is Mandishta Dikshara Basti and Tiktaka Kshira Basti and Rajayapana Basti. Depending on the disease condition, I am selecting these three Bastis for the management of the avian cases. And Virechana Karma is classical Virechana. If needed for the patient, then we go with the classical Virechana management. And even the Rakta Mokshana. So Rakta Mokshana, Siraveda is not needed, but Jaloka Charana in sometimes I am going to add patient. So coming to the Snehana Karma, Abhyanga. Yes, Abhyanga is because of it is a Vata Shamana and Dhardekara. Dhardekara means Sapta Dhatu Dhardekara. So Abhyanga is very helpful in case of the Vata disorders. And Svedana Karma, yes, Tambagauram, Sitagnam, Svedanam, Svedakakam. So it's like a Svedana, it's like an emergency or immediate and acute management of the Vata dosha. Whenever the patient is coming with the severe pain and stiffness and stambata and shota and there is intolerance pain, then you may go with you go with the Sarvanga Abhyanga and Bashpasveda. Immediately the 50 to 60% of the pain will get reduced by the Svedana Karma. So that's why acharyas are beautifully told that Charaka Samhitas told that Stambhagavaram, Shitagnam, Svedanam, Svedakarakam. So it relieves the Stambhata, it relieves the Gauravata, that is, it relieves the heaviness of the body, it gives the lightness, and Sitagnata. So it relieves the stiffness and shula, and it gives the relief from that particular shula pain. So Basti Karma, so main line of the management, that is the Basti Karma. So Manjishtadik Shara Basti, I am taking here first line of as a first line of management. So why Manjishtadik Shara Basti I am taking here? So Manjishta contains the, yes, of course, the Manjishtadi Kashaya, and Manjishta contains the Gomutra and Kanji also. So with the Gomutra and Kanji, the Basti Dravya will become very Tikshna in nature. So due to that Tikshna, it does the Lekana Karma, it relieves the Avarana. Yes, there is a Avarana pathology in the avascular necrosis. Because of the Avarana, there is a Srotodushti and there is a Kavaigunata, that is obstruction, and there is a Sangha. So once you remove the Avarana, then only it is possible to make the normal circulatory function in that particular vessels, that is the blood vessels. So it is Tikshna in nature. Due to the Tikshna, it is Vata Kapara, and it is also the Rakta Shodaka. So as a first line of the management, we need to go with the Manjishtadik Sharavasti first to remove the Avarana pathology, and to do the Rakta Shodana, and to do the Shoto Shodana, and to do the Vata Kapha Shamana, and with the Lekana properties. Wherever the Shota is there, it will reduce the Shota. So that's why Manjishtadik Sharavasti is the first line of the management in almost all the cases of the avian. So instead of the Manjishtadik Sharavasti, if we go with the Rajayapana Basti or the Tiksaka Shiravasti, it will be very difficult, because without the removing the obstruction, without the removing the Avarana, we cannot supply the nutrition to that particular part of the bone, that particular part of the tissue. So that's why the Manjishtadik Sharabasti plays a very important role in case of the avascular necrosis diseases. Okay. So next line of the management is Tiktaka Kshiravasti I am planning, because Tiktaka Kshiravasti, it is Vata Pittahara and it is Asti Dhatu Poshaka. Asti Dhatu, it has the Tiktaka, then it is Vata Shamana as well as Pitta Shamana, and it does the Asti Dhatu Poshaka, and it is Shulahara. It gives the Vatara and Shulahara Chikisa, Shulahara benefit also to the patient. And finally, Rajayapana Basti, when the patient is in Niramavasta, patient is, when it comes totally only Vataja, and there is no any Dvandvaja doshas like Vata Kafaja, Vata Pittaja, if not there, when you will come to clearly come to know about the only Vata dosha is there, Rukshata is there more. Now we need to go with the Brahmana and Rasayana Chikitsa, like to regenerate the bony part. Once the obstruction is removed, and once the we need to go with the Charabasti, because Asti dosha, this Sroto Shodhana will happen, and there will be a no obstruction in the blood vessels. That time you have to go with the Rajayapana Basti, because to regenerate and to give the Brahmana effect and to regain the strength of that particular part of the bone. So that's why Rajayapana Basti is very important. Then when to go with the Rajayapana Basti, when to go with the Tiktaka Kshira Basti, when to go with the Manjishtadik Shara Basti, it's clear now. But Manjishtadik Shara Basti may be planned as a Yoga Basti pattern, or if the patient is having Uttama Bala, if still the Ama condition is there, still the Avarana condition is there, then you may continue it as a Kala Basti, and later giving 2 or 3 weeks or 4 weeks gap, then go with the Tiktaka Kshira Basti, and later again once more you have to give with the gap, then go with the Rajayapan Basti. These 3 Bastis were given a very good result in almost all the 30 plus cases of the avians. So coming to the Virachan, that is classical Virachana, in case of Ama Pradhana as a dosha is there, Ama Pradhana dosha is there, then go with the as a Ama Nirharana classical Virachana, and then as a Vatanulomana and Rechana property, you may go with the classical Virachana management. That is also Snigdha Virachana with the Erenda Taila Virachana you may plan. So I almost 3 to 4 cases I went with the Virachana Karma, And after Virechana, the patient got a very good uh, result from the AVN. So Rakta Mokshana, that is Jalokacharna as a Stanika Chikitsa, where the patient is having local rise of temperature at the hip joint and where the patient having the swelling and redness at the hip joint, you may go with the Rakta Mokshana. But most of the times, the Jalokacharna is not needed. So coming to the Shamana Chikitsa. So Shamana Chikitsa, I am selecting the Shamana Chikitsa as a Shamana Chikitsa. These are some of the drugs. Frequently, I am advising not all the drugs at a time. I am selecting the some of the drugs and I am advising one or two tablets and with the Kashaya Dravyas and one as a Rasayana Chikitsa. So Punarnava Mandura, Bhukshiradi Ugulu, Arogyavardhini Rasa, Asti Poshaka Ganavati, and Maharasnadi Kashaya and sometimes Mahamanjishtadi Kashaya. Punarnava Mandura, why Punarnava Mandura? It is hematonic and also it is circulatory stimulant. It improves the microcirculatory stimulant. And there are some of the studies also conducted and some of the articles also we may get on the Punarnava Mandura. The study was conducted and there will be it is proved that it is hematonic and it is microcirculatory stimulant. It improves the blood circulation. And coming to the Gokshura, the Gugulu is the best drug to introduce in the avascular necrosis because it has an anti-inflammatory action, it has an osteoprotective, and it has an anti-lipidemic and detoxifying agent as a Gugulu. So Gokshura adi Gugulu. Gokshura, it is Mutrala and it is Shotahara and it is also act as a anti-inflammatory. That's why Gokshura adi Gugulu I am selecting in the almost all the cases. And Arogyavardhini, as you know all that, Arogyavardhini is the best for the Dipana, Pachana, and the Shroto Shodhana. And coming to the Asti Poshaka Ganavati, yes, it is prepared just for the mainly for the Asti Dhatu Poshaka. So that's why whenever the Nirama Masta is there, when after the Rajayapana Basti and after the Tiktaka Kshira Basti, you may go with the Asti Poshaka Ganavati. And coming to the Maharashna, the Kasha, it is Vatashamana and Shotahara and it is Vedana Stapana. Best Vedana Stapana. And coming to the Mahamanjishtadi Kashaya, it is Rakta Shodaka, Vata Pitta Shamaka, and Sota Shodaka, and also the Shotara. Looking into the all these of the Shamana Chikitsas, all the drugs are having the properties like anti-inflammatory action and Sota Shodaka action, Rakta Shodaka action, Rakta Pravartaka action also with the Manjishtadi Kashaya and Maharasnadi and Asti Poshaka Ganavati. So once the Asti Poshaka Ganavati is given, when the Asti is getting good poshana and good nourishment, then there will be a Majja. That is Uttara Dhatu Poshana takes. Once the Majja is properly taking the nourishment, there will be a RBC production. Once the RBC production is there, then automatically there will be a Rakta Pravartana. Then once the Rakta Pravartana is there, then there will be a supply of the blood to that particular bony part. Then the vascularity will improve that particular part. There will be no chance of the spreading of the necrosis. And all the Shamana Chikitsas having the properties like Vatahara and Vajana Stapaka and also the Rasayana. So that's why I am taking and selecting these all the drugs for the treatment of AVN as a Shamana Chikitsa. So coming to the Rasayana Chikitsa, that is Gulu Tiktaka Grata, Shirabala capsule 101 and Gandha Taila capsule. Gugula Tiktaka Grata, very important drug in case of the avian, that is because it is as a Charaka Samhita told, Charaka has explained that Gugula Tiktaka Grata is best Asti Majja Dhatu Poshaka Dravya. And it has the Shodhana effect also, it has the Rasayana effect also. That's why I am taking the Gugulu Tiktaka Grata. Just hardly after the Shodhana, after the Bastikarma, just give 2 teaspoons with the milk at empty stomach at early morning. Only once in a day. Up to 2 to 3 months, then the patient will get a good improvement after the Gugulu Tiktaka Grata. Then Kshirabala capsule as a Brahmana and Rasayana Chikitsa we may given. And Gandha Taila capsule as an anti-inflammatory and analgesic action and Asti Majja Dhatu Poshana, and it is also has the Rasayana effect. Then when to go with the Tiktaka Grata, when to go with the Kshirabala capsule, when to go with the Gandha Taila capsule, it depending on the Yukti of the Vaidya. That is Gugula Tiktaka Grata, once the patient is done the Shodhana properly, there will not be any Avarana pathology, there will not be any Ama Avastha, there the completely Vata dosha involvement is there, then we may go with the Brahmana line of the management like Guguru Tiktaka Grata. And Chirabal also same, when the patient is having the chronic disorders, when there is a degeneration of the bony tissues is there. Other than that, AVN also in other cases, also in case of joint disorder, in case of knee joint, and in case of spinal disorders, then so with the AVN there is other condition as that. Then go with the Ksheerabala capsule 101, and even the Gandha Tail also same as the this Ksheerabala capsule. And if the pain is there, then we want to do the Brahmana and Rasayana Chikitsa. Then we have to go with the Gandha Taila capsule. So these are the some of the yogasanas: Supta Padangusthana and Bhujangasana, Setubandhana and Makarasana and Pavana Muktasana may be advised in case of avascular necrosis. So physiotherapy, so non-weight bearing exercises, range of the motion exercises, and strengthening exercises, electrotherapy like ultrasound therapy, TENS therapy, IFT therapy, infrared therapy, you may advise depending on the patient condition. And gait training. Gait training is very important, because when the patient is having the limping gait, then repeatedly ask the patient to walk in front of the mirror to correct his gait or the walking position or walking style. Because once the patient is started with the limping gait, when automatically it will become habitual. So that's why ask the patient repeatedly, walk in front of the mirror, correct yourself, your walking style straightly. So that is great training is very important one in case of AVN management. So essential lifestyle modifications like active and mobility adjustment, active and mobility adjustment. So whenever he is sitting, whenever he is walking, whenever he is sleeping, whenever he is riding the bike, that time patient need to take very careful with kicking the bike, because the posture also very important one in case of AVN. And weight management. So if the patient is having more weight, of course there will be a more pressure over the hip joint. So weight management is a very important. And if the patient is having the habit of smoking, taking the smoking and alcohol session, so patient need to stop these things. And diet and nutrition, a good diet with a nutritional food is needed for the AVN cases. And sleep and daily routine, that is dinacharya, should be followed. The good sleep is needed to the patient. And stress reduction, these are all the lifestyle modifications. So I am coming here with a presentation of 5 AVN cases here, before and after treatment, before and after, how they improved and what all the improvements are seen in that particular patient. And after the treatment, which treatment I have advised, will go one by one. A diagnosed cases of AVN head of the femur were taken, and almost all the 5 cases were presented with all the symptoms related with AVN. Each cases was thoroughly assessed with the Dhatu and dosha samurchana, and treatment advised as per the Samprapti and Samprapti Vigatana Niyama Chikitsa has done. And treatment goes like Shodhana, Brahmana, Shamana, and Rasayana Chikitsa advice for all the patients with Patyapatya. And Shodhana, Basti Chikitsa were selected in almost all the patients as a prime line of the management, and Basti combination changed as per the needs like Shodhana, Brahmana, Shamana, and Rasayana. Am I audible, madam?
Yes, sir.
Yes, sir.
So coming to the case number 1, here the 19-year-old male patient diagnosed as a AVN femoral head left side. So MRI of hip joint reveals that grade 2 avascular necrosis of femoral head. So the patient came with these avascular necrosis symptoms, and there is a stiffness, there is a difficulty in walk, there is a little bit of limping. This is a 19-year-old patient came with AVN in 2019, I think. Okay, so patient came to me, and he was just asked me that I'm going for the surgery of this avascular necrosis of hip. So is it possible to treat with Ayurveda line of the management? If there, I will give a time just for 3 months. If you are not treated, if there is a pain, then I will go with the uh, surgery. That the patient was told me. So then I told him, just give me 2 months. So if the patient got just 60% relief, then we'll continue with our treatment. If patient is not got any relief, then I will take to you for the to the surgeon and we'll go with the surgery. So first line of the management as a Manjistadik Sharabasti and Matravasti with Bras Saindava Taila and Savanga Abhanga Bhashva was advised as a Yoga Basti course here for the Sotomukha Shodhana and to release the Avarana. So in between this, after the Manjistadik Sharabasti, the patient got the 30% of the relief with the complaints. And after the Yoga Basti, I advised the some of the Shamana Aushadhis. And after 2 months, once more I called the patient and advised Tiktaka Kshirabasti and Matrabasti with Gugul Tiktaka Gratam and Sarvanga Abhanga with Bashpa Sweda as a Brahmanartha, because there will not be that much of the Shula in that particular patient after the Manjishta Diksharabasti and after the 2 months. That's why Tiktaka Kshirabasti was advised after the 2 months of that Manjishta Diksharabasti, then patient got 50% of the relief. So after 3 months, so continued with the oral medication. So after 3 months, I advised the Virechana because the Amalakshanas was there and multiple joint pain was there and CRP was high, C-reactive protein was high. So this patient got AVN because as a secondary infection to the monoarthritis, this patient got the AVN at the left femoral head. That's why thinking with the Ama pattern and with the Vatarakta pattern, I advise this patient the Virechana Karma. Then after the Virechana Karma, then for 1 year, in between 1 year, again once more this Raja Apanabasti was advised. Then after 1 year, both hip joint shows the normal appearance. There is no evidence of AVN after the MRI report. So it is surprisingly, I have seen this case previously. It was avascular necrosis, and after 1 year, after the repeat MRI, it shows that there is no evidence of the AVN. So this is the data. So before and after, and this case was published in IIMJ in 2020 and 21. So after 1 year, it will be MRI reveals that there is no evidence of AVN and both hip joint shows normal appearance. So photo is not visible here. So you must see the MRI reports before and after. So coming to the case number second. So 30 years of old male patient diagnosed as a AVN of the femoral head bilateral, and MRI of hip joint reveals that avascular necrosis of bilateral femoral head and stage is second stage. So as usually, I advise the Manjishtadik Charabasti as a first line of the management with the Matrabasti, with the Bras and the Pela and Sarvanga Benga and Bashpa Sweda as a Shruta Shodhana and Avarana. After the Manjishtadik Charabasti, after 1 or 2 weeks of the Shamana Aushadhis, I advised to this patient the Jalavakasarana because there will be a local rise of temperature was there and local discoloration was there little bit and tenderness was there. So Jalavakacharana was advised to this patient, only this patient. And after the Jalavakacharana, the patient got a relief from the stiffness and local rise of temperature. Maybe the avarna was released from the localized blood circulation. Then after the 15 days, so Manjishtadik Sharabasti and Tiktaka Kshirabasti, it will be a 3 weeks of the gap. So Tiktaka Kshirabasti was advised after the three weeks of the gap, and Matrabasti with the Gugul Tiktaka Gratam for the Brahmanartha and for the tissue regeneration. So 50% of the relief patient got, and after the Tiktaka Kshirabasti, after 2 months of the gap with the continuing medications of as a Semanauchidis, and after the 2 months gap, I have advised the Rajayapana Basti as a Yoga Basti pattern with the Matra Basti with the Gugotikta Kratam and Sarvanga Penga and Bashpa Sweda. There, because why Rajayapana Basti is taken here? Because there will not be a Shula here. There will not be a Shula here. So for the Balya and for the Brahmanartha, I have taken here the Rajayapana Basti. You may see the before and after the patient walking here. Patient is walking with stick, and after the Rajayapanamasti, after 6 months of the gap, the patient is running. See, and coming to the case number 3, 33-year-old male patient diagnosed as a bilateral avian of the femoral head. An MRI reveals that avascular necrosis of the bilateral femoral head with grade 3 with mild hip joint effusion. So again, Manjishtadik Sharabasti was given as a Shrota Shodhana and Avarana. And here, instead of Tiktaka Kshirabasti, I have given the Rajayapana Basti because patient looks like the Vata Prakriti and there is no the Dvandvaja. There is no Vata Kapaja and no Vata Pittaja involvement is there. So directly when after the Manjishtadik Sharabasti, after 3 weeks of the gap, patient can with reduction of the pain completely up to 80%, but limping was there and stiffness was there. That's why Rajayapana Basti was advised because the Nirama Lakshana was there. For the Brahmanartha and Balya purpose, Rajayapani Basti was taken as a second line of the management as a Basti Karma. And after that, the Tiktaka Kshira Basti was advised. So patient was unable to walk before the Manjishtadik Sharabasti. After the Manjishtadik Sharabasti, he is walking with a little bit of the limping. Till today, patient is having the little bit of limping, but there will not be any pain. So coming to the case number 4, 41 years of old male patient diagnosed as a bilateral avian of the femoral head, and MRI reveals that grade 3 with a mild hip joint effusion. So here also the Manjishtadik Sharabasti was taken as a Sotamukha Shodhana and to relieve the Avarana. And again once more this Manjishtadik Sharabasti was taken in this case because Amalakshana was there. Patient looks like Kafaja, that is Kapha Prakriti, and patient is little bit of fatty. So he was having the more stiffness and he was having the more what difficulty in walk and more limping. That's why 2 times Manjishtadik Sharabasti was advised, and after the first Manjishtadik Sharabasti, that is the 20% of the relief was seen. And after the 2 months or 3 months of the gap of the Manjishtadik Sharabasti, the Tiktaka Kshirabasti was advised for the Brahmanartha and regeneration of the bony tissue. This patient is coming from the Mumbai to the Belgaum and is taking he is coming for the just for the Basti Karma to take the treatment for the avascular necrosis. Until today, patient is fine. He is running now. A little bit of limping is there, but there is no problem with his regular routine. So coming to the case number 5, the 41-year-old male patient was diagnosed as a bilateral avian, and MRI reveals that there is a bilateral femoral head necrosis of stage 3. Here the Manjishtadik Sharabasti again as a Sotomukha Shodhana and Avarana, and next with the Niramasta Lakshana was seen, and for the Balya I advised him Rajayapana Basti and Matra Basti with Panchatika Gulugrata. After the Sarvanga Abhyanga and Bashpasveda, the patient was having more limping. So I forget to take the first visit video of this patient. And this is second visit video. Patient is walking with the minimal limping and patient is fine now. So almost 70 to 80%, the patient is not getting pain now. So these are all the 5 cases I have taken here, mainly with the different uh, line of management followed by Manjishtadik Sharabasti and also the Shamanavasi. And like this, I have the more than 30 plus patients with the avian cases. I am treating the same line of the management. Almost all the patients are getting a benefit, and hardly out of 35 patients, only 1 or 2 patients went for the surgery with against the medical advice. So now they are working with the difficulty and they are not setting on the earth, and there are some complications, there are some difficulties are there after the surgery also. So almost all 30 patients are fine now. There is no any more pain, and almost every patient is getting relief from all this Ayurveda management. So future scope, that is Ayurveda and evidence based future scope. Evidence-based practice is needed. So bridging the traditional with modern and integrated Ayurveda in early grade of the avian management, digital monitoring, the pain scale and imaginary techniques. So multi-centric studies using the Panchkarma and Rasayana is needed for the future scope. So research needs to limited curative option in modern medicine and unclear etiopathogenesis. There is no uh, a proper etiological factors are seen in the avian, because everyone telling that with the corticosteroids, with the trauma, with sickle cell diseases, it is having the avian, but it is still today it is idiopathic, it is unclear. So the research is needed on this, and potential for integrated and Ayurvedic approaches in the avian management is needed, and rising the incident and younger age groups affected. Now it is rising the incident after the COVID, and long-term outcomes of the surgical intervention are suboptimal. So long-term outcome of surgical intervention are suboptimal. So it may be taken, it may not be. We have the some limitations in even in case of the Ayurveda practice also. We have the some limitations to treat the avian cases. Once the avian that is neck of the femur was fractured, so it is not possible to treat with our Ayurveda. So we need to go with the surgery. And once in between the treatment also, patient may get the more pain, intolerable pain. That time also we need to take the support of the some of the allopathic drugs like signoplam or the tramadol or some of the drugs just for the emergency acute management. We need to take the help of with our allopathy medicine, and we have to proceed with our treatment protocols. So because once the patient got more pain, if you are not treating with the some of the emergency medicine, the patient may shift to the another doctor, or you may miss the patient, and the patient may get loss by taking the surgical management and any other management. So we can treat with the help of the other medicine also. So to conclude the session, so whenever you are treating the diseases or the avian cases, you need to look into the samprati first, which dosha involvement is there, whether it is Amapradana Vyadhi, whether it is Nirama condition is there. Depending on that, you have to plan your treatment. And Manasopachara is very important. That is the counseling is very important. Whenever you are taking the patient, you need to explain the patient how much time duration it is taking to cure your disease. Okay, so it is not possible to cure within 15 days, within 1 month, within 3 months. It takes the 1 year to 1.5 year to treat the avian cases. So of course the Pachana Dipana drugs is needed in almost all the cases whenever you are going for the Shodhana. So before Shodhana, you need to go with the Pachana and Dipana, and Shroto Shodhana drugs, Shodhana with Brahmana Chikitsa, and also followed by Rasayana Chikitsa and Patyapatya Chikitsa. So with this, I, I conclude my session. Thank you. So any questions?
Yes, sir. So please see the comment box, sir. There are few questions.
Yes. Yes. Dr. Neela Suresh is asking, can you give the permanent results in avian cases? Yes, of course. We may give the permanent solution to the avian cases. As you saw the first case, that is 19 years of the old male patient. Till today he is running, till today he is cycling, till he is riding bike. There is no any problem. And after the MRI, repeat MRI of 1 year, there is it shows that there is no evidence of avian. So further research was needed here. And even the patient lifestyle is, there is no difficulty in his regular lifestyle. Almost all the 30 patients, yes, of course there will be a little bit of pain is there and little bit of limping is there, but still patient is surviving with that little bit of the difficulties. There is no any problem while riding the bike, even while riding the car also. So we may go with the our line of the management. So one more question is, can we give the permanent results in case of event, because many cases of symptoms are reoccur? All these line of the treatment only limits the further degeneration, or can we reverse the condition? Yes. See, you may assure that to the patient, we may stop the disease here. We will not give the chance to further progression of the disease with this line of the management. But we can reverse the condition also. Luckily, if the patient got a good benefit, as whichever we are planning the treatments with the Anumana Pramana, if the patient got the complete relief, and there is a chance of the to reverse the condition. Like already one case was discussed, and one more question: can Vankshana Basti, we may help? Yes, you may plan any bastis depending on your yukti, depending on the karmukata, that is the mode of action of the basti, and depending on the karma of that basti, you may plan. See, I'm not limiting only these. You can give the avian patients, so you may practice beyond these also. You may give the any type of the treatment also. Even you may practice the patrapinda sweda if the patient is getting more pain. Even you may go with other line of the management like parisheka. Any management you may go, but depending on your yukti. What are the our limitations set? I already discussed limitations. So once the fracture happened, it's not possible to treat with us. What is the logic behind the giving Sagrata Basti? Sagrata Basti as a Brahmana Chikitsa, as a Brahmana, and as a Dhatu Poshana, Asti Dhatu Poshana. Yes, Tiktaka Grata, already Charaka was told that it is best Asti Poshaka Dravya. So that's why in the Rajapana Basti and in the Tiktaka Kshira Basti, sometimes I used to go with the as a Sneha Dravya, the Tiktaka Kshira Basti. Which oil can we go for the Sarvanga Abhyanga in case of avian? Yes, Sarvanga Abhyanga. Why I am going with the Sarvanga Abhyanga and Bashpa before going for the Nirho Basti? Before going for the Nirho Basti, Sarvanga Abhyanga, as a Sarvanga Abhyanga, you may use any of the oil. You may use Mahanara Taila, you may use Kshirabala Taila, you may use Dhanvantara Taila, any of the oil you may use. If the patient is having no Avarana pathology is there, then you may go with the Kshirabala or the Ashwagandha Taila, Balashwagandha Taila, any Taila you may go, and Bashpa Sweda. And once the Snehana and Svedana done, then you have to go with the Sharabasti or the any type of the Nirobasti. Without Snehana and Svedana, at least Stanika Snehana and Stanika Svedana is needed before going to the Nirohabasti. Because there will be a Baddha Dosha Vilayana, Soto Shodhana, and to clear the channels and to travel the doshas from Shaka to Kosta, and it is expelling out. The Snehana Svedana will help more in the Basti Karma, in the any of the disease. So Parsheka to be done with which oil? Parsheka may be done with Ashwagandha Taila or Balashwagandha Taila in case of Kevala Vatavadi. Does Shamana Snehana helps? Yes, of course, the Shamana Snehana is going to help in the avian cases. That is also after the Niramavastha condition. And does Nitya Virechana helps in avian? Yes, may be given Nitya Virechana, may be given. So I am not given the Nitya Virechana into any case. I have given the classical Virechana to the some of the cases. So any questions? Yes, can we advise Virechana as a first line of the management followed by the Bastikam? Yep. Yes, the patient, if the patient is having good strength, if the patient is having tolerable with the pain with the Snehapana, because after the Snehapana, you have to follow the Snehapana Patya Patya, right? So if the patient is ready to tolerate the pain, then you may go with the Virechana, because once patient come with the severe pain, there is a limping. That time you are stopping the every all the medications and going with the Snehapana. It is very difficult, because once you have started the Snehapana, there is no chance of taking the any medicine in between the Snehapana. That's why it's very difficult in the first line of the management going with the Virechana. If patient is willing, if the patient is ready, you may go with depending on your yukti. The same mode of treatment can done in case of long-term steroid use. Yes, resulted avian. Yes, almost all the cases out of 30 patients, almost all 15 to 18 or 20 cases, I have the post-COVID avian cases. You may go with the same line of the management after the steroidal use also, resulting avian. Yes, any other questions?
No, sir.
Thank you for clearing doubts, sir. I am still reeling from the mind blowing session. The insights shared were impressive, empowering, and motivating, inspiring us to think in new direction. On behalf of Team Ayuryana, I extend heartfelt gratitude to our esteemed speaker. Thank you, sir. Huge thanks and gratitude to our entire Ayuryana teams for organizing this incredible webinar. Your collective efforts have made a significant impact. धन्यवाद to each and everyone.
Thank you, madam. And once again, I thank the and congratulate all the Ayurveda team members for conducting such events. And thanks for inviting me. Uh, and with the bottom of my heart, I am telling the thanks to all the Ayurveda team. And thank you, Anand. Even audience also, I am very grateful to because they are spending the valuable time here. Thank you, Anand. Thank you.
Thank you so much, sir.